you to approve. Okay. And then I'm going to go ahead and start. So are you ready?
Yes.
Hello and welcome to Neuro Challenge Foundation for Parkinson's disease. We are so happy to bring to you today a very important topic for people with Parkinson's, which is driving and whether or not that is still safe for you. So we are going to have Brandy Pouso here today. And Brandy is a physical therapist. She's also a certified driver rehabilitation specialist, and she works at Sarasota Memorial Healthcare Center, which is in Sarasota, Florida. So if you are tuning in from out of state, that's okay. Hopefully you are going to learn some really great information about, making sure that you are still prepared and ready to be a good driver. I would like to fill you in a little bit about Neuro Challenge in case you're new to us and you're tuning in from out of our state. But Neuro Challenge is a small organization in the southwest region of Florida. We serve people with Parkinson's disease as well as their care partners and family. We are a resource provider, and we also offer programs that are educational, supportive, and therapeutic throughout the year. And so without further ado, I would like to introduce Brandy, and she's going to talk to you today about driving and whether it's safe or not for you when you have Parkinson's disease. Welcome, Brandy.
Hi, thank you for having me. Appreciate the opportunity to be here. So I'll just go ahead and jump right in because there's a lot of information to cover on such an important topic. So in our American culture, most of us realize and agree that driving is very important to us. And especially in a state like Florida, we don't have a lot of, and where I live, Sarasota, Florida, we don't have a lot of mass transportation like the subways and stuff like that for the public to get around in. Everything is really much more personal vehicles is the primary way that people get around. And so driving is really important, I think, for us in general as Americans, and trying to maintain our independence and our ability to just go when and where we want to without having to rely on someone else, but also just our transportation culture. We're not in Florida, we don't have super big cities with the public transportation, kind of like New York and Chicago might have. So driving is a very important skill that people would like to try and maintain as long as possible. And then obviously also in our state, given our temperature and our climate here, we have a lot of elderly people who come to retire. And so that's another issue with driving in our state is just by definition, we have a geriatric population. And although I'll say this every day with the people that I work with, although age is not an automatic disqualifier for you and your driving, it is a relevant factor. It's a very relevant factor that we have to take into account in addition to whatever medical diagnoses somebody may be struggling with. So the driving requires a lot of skills, and that encompasses pretty much your whole being. And so your age comes into play, as well as when anything that may be affecting you mentally, physically, or your vision. So if folks are tuning in from out of state, you'll have to take into account that I'm speaking from a Florida standpoint and Florida's laws, and the laws from state to state can vary, but some things are similar. And so we can still talk about some commonalities. But as far as driving goes, I think the first thing, a good place to start is just recognizing, yes, it's an important thing to us. And so we all have usually emotions tied to our driving because it's so critical to our daily lives. And if we let go of driving, either voluntarily or because we're forced to do so for some reason, it is a significant change to one's life. And sometimes you can lose that driving privilege temporarily. Say, for example, if you had a stroke, and so temporarily you had to stop driving because it was safe, but later on you can get it back if you improve your skills. Sometimes you're being able to get back to driving, but on the other hand, there's sometimes where if you have someone who's of advanced age, say they're in their 80s or their 90s, and they have severe Alzheimer's, for example, as a diagnosis, or even severe Parkinson's, we could put that in there as well. That would be a time where you're looking at your driving retirement, and not either voluntarily or forcefully having to let go of your driving privilege permanently. So driving is important to us, but it's also a privilege. It's not a right. And that's a big thing for us to try and keep in mind, because most people that I work with have been driving for decades, literally decades and decades. And they have done that in our state, usually without being required to do any retesting for their driving at all. So in the state of Florida, there is no requirement legally to be retested for one's driving ever. Not at any age or any interval, which I find shocking and dismaying, and most people find it surprising too. Our laws, if you hit 80 years old and you need to update your license, you are required to have your vision checked, but that's all. There's no requirement for testing your traffic knowledge or your driving practical ability. So as a result of that, we have a situation in our state where we have many people driving when they shouldn't be, but nobody's checking them, and they tend to fall between the cracks, which is not a good thing, obviously, because that makes the roads unsafe. So, and it makes us unsafe as well. So driving is important to us, but it's also a privilege, and you'd want to look at the laws in your state to see what you are required to do in terms of retesting. Again, Florida has no laws requiring that. So that puts us in a quandary. But also, when thinking about driving, it's not just about what we want to do, it's also about safety, and our personal safety as well as the safety of the community out there. And so we have to think about these things too, and try to do things in a responsible manner. Because if we end up being the ones that hurt someone, then we could be held potentially liable for those things. I lost my picture, so I don't know. I'll just keep talking as if everything's okay. Okay, you're back. Okay. Okay, so Parkinson's is a very challenging and difficult diagnosis. And I know I'm not telling you guys anything that you don't know with that, but as a physical therapist, and I've worked with a lot of people with Parkinson's disease and Parkinsonism over the course of my physical therapy career, also over the course of doing these driving evaluations. And it's a very difficult and challenging situation for the individual, as well as the family and caregiver that's working with that person. And then it's very challenging to add in trying to continue to drive with that diagnosis. So with Parkinson's, we know that you have physical challenges that occur. We know that you have cognitive challenges as well as vision. And then you add on top of that, some of the medications that you're given can have a serious effect on you too. So if you are a person that I work with frequently, I am working with a person who not only is older, but also has Parkinson's. And so then you have to ask yourself, well, how long has this person has had Parkinson's? Because with normal, healthy aging, we know that people slow down physically. We know that they slow down mentally, and we know that their vision becomes more impaired. And that's the trifecta for driving. If all of those things are becoming more impaired just with normal, healthy aging, that affects people's driving and tends to slow down their reaction time and make them less safe behind the wheel. And so when we look at the spectrum of just healthy aging, the groups that are the high risk drivers are the youngest drivers and the oldest drivers. We know that just looking at the data. They're the ones that have the most accidents and the most injuries. And why? Well, the younger people, because they're impulsive and inexperienced. And the older people, again, because everything's slowing down. And it's not just one thing slowing down and impairing, it's all three systems: physical, cognitive, and vision. And that means your reaction time in general is slower. Your driving is slower. You're becoming an obstacle that everybody else is trying to get around. And so then you throw in the Parkinson's or the Parkinsonism, and okay, when was the onset of this disease process? Because sometimes it happens early, sometimes it happens late. What is the progression of this process? Is it mild, moderate, severe? And with some people with Parkinson's, things progress at a very slow rate. Other times it progresses quite quickly. So every person's case is very individual. So if there's a question about someone's driving, many times it could be very beneficial to have somebody like me look at your individual case. Because yes, there's generalities, but still nothing can substitute for having that one-on-one interaction and the individual being able to present what their specific case is and what their specific impairments are versus abilities. So everybody's case really can be quite different, and that's important to keep in mind. And there's things going on when really, again, as an American society, we think about retiring from our professions. We project for that and we plan for it. But people don't tend to think about, what if I can't drive for the rest of my life? But really, we need to change our mentality and start having that kind of conversation and thought process with ourselves and others. And if we think about, eventually I may have to retire from driving, how am I going to work that into my life plan and still maintain the highest quality of life that I possibly can? And so we know from the research that they do right now, most people, and people, again, with medical technology as it is, people just keep living longer. And as a result, people are outliving their ability to safely drive, they say, by 7 to 10 years. 7 years for men and 10 for women, because women tend to live a little bit longer. So, but that's a chunk of time where you really need to have a plan for your life. And if you have a plan that this may happen and you know how you may move through this transition, then it won't be as shocking and devastating if you do need to let go of your privilege of driving, either, again, voluntarily or otherwise. So it's something to go ahead and start thinking about now, regardless of your age or the progression, the disease, like the stage of the disease process that you're in. Because both things acting on you, the aging and then the Parkinson's, are going to affect you. And looking at the big picture, that will be when to make decisions, various decisions. One thing to think about is doing some self-reflection as to what your life goals are, and thinking about, as I go through my life, if I have to think about possible driving retirement, do I perceive myself as the type of person who would prefer to stay in my own home and pay for services to come to me? Or would I be the kind of person who might do better in a place where I have assistance, say an independent living facility or an assisted living facility or a long-term care center? These are places where the care is present for you. And a lot of times these places also have transportation services, at least a basic amount, that's part of that community services that you're paying for. And if that, that's a big question just to ask, because then at least you have a route that you can pursue on whether or not you want to stay in your own home or maybe go somewhere where you can find the help. Either route you go is going to cost you a lot of money. Neither option is cheap, but it's still, at least it puts you on one direction and you can start then making plans. And in our state, again, we have a lot of retirees. So if the person does want to move to the type of place where they have assistance available right where they live, frequently you want to tour these places and find out one that's good for you, close to the things that you want to do. And then also, if they're a good place, a lot of times they have a waiting list and you have to get on that waiting list so that maybe you have the ability to enter into that community when it's the right time for you. So the first part, I think, is to just do some self-reflection about what you think your own abilities are. Those areas: vision, cognition, physical capabilities, and also look at what other medical diagnoses you have may be affecting you. If you have neuropathy, if you have sleep apnea, there's things like this that are also risky for driving for different reasons. And so anything else in your medical history can also complicate the situation further and make you an even more risky driver. Also, your medications, I mentioned that before. It's another big thing to take into account too. So after doing some self-reflection, because most people I know think they're great drivers, so no one seems to be that objective about thinking about their own driving. Everyone thinks they're a great driver, assumes they're a great driver for the most part. And so, but that's still step number one. And then step number two, I would say, is look at people in your sphere of influence who are family members or personal friends, or even professionals in the medical community that you believe these people have your best interest at heart. They know you, maybe they have either special knowledge of you or your medical situation, and you can talk to them and you can have a conversation about driving. A lot of people don't like to talk about driving. So just because it's a sensitive topic, but you have a wealth of information around you usually, and you can ask people for either their personal judgment in regards to what they know about you or your professional judgment in the medical community, your doctor, your neurologist, your therapist, OT, occupational therapist, physical therapist, speech therapist. They can all provide you good information about what your abilities and limitations might be to help you make good decisions about driving. So I do certified medical driving evaluations in the state of Florida, but I'm putting personal responsibility back on people and on families and on their own medical doctors and therapists, because no one knows you better than you. So your opinion, and if you have people in your life who are supportive and want your best interest at heart, they have good information about you too that can help you make good decisions for your own driving, because the first person who can determine if you should still drive or not is yourself. And a lot of people kind of leave that step out, but there are people who will look at their specific situation and they will decide to take themselves off the road. And I think that's 100% appropriate. And I'm very thankful for those folks who make that decision for themselves. And again, I think that's a small percentage of the population, but that's still, you're responsible for yourself first. You're responsible for your driving privilege. And if you're starting to feel that you're having some near misses or you're just feeling uncomfortable, then that's the time to start asking, maybe I should consider letting driving go. Because if you've had many, many years of an excellent driving career, the worst way to end that driving career is with a terrible accident where you hurt yourself or someone else. So we have to always remind ourselves that when we're talking about driving, it's life or death out there for you and other people, and it's your responsibility if you're behind the wheel. So if you have any sense that, again, your skills are falling, or you're having some near misses, that's the time to really start seriously considering letting go of that privilege. Now, sometimes instead of having to stop driving altogether, sometimes you can just self-limit and restrict yourself as to where and when you go. So maybe you would stop driving at night. Maybe you would stop driving long distances. Maybe you would stop driving during heavy rainstorms and fog and things like that. And those are all very smart, appropriate, prudent decisions to make. And that may help elongate your driving career, because if you're driving in familiar short distances during the daylight hours and all these things, this increases your chances for safety. And like I said, and so sometimes it's appropriate to self-limit, and then you could probably extend your driving career a little bit further. But a lot of people are fortunate to have people in their lives, even if it's not a family member. Sometimes it's a helpful neighbor or just a friend who's like family to you, and they can see you starting to have difficulty with certain things. They may not feel comfortable bringing up to you the question of driving, so you could ask them, but this would give you more information beyond just your own opinion. And sometimes their information can be more objective because they're looking at it from the outside in. And one of the big challenges with Parkinson's can be you don't always have good insight into how much you're changing. And you change slowly from day to day, but then that means from year to year, it's a bigger change. And you don't always see how significant you've changed. I say, like, when I look at myself in the mirror every day, I don't think I'm changing that much. But when I look at my wedding pictures from 20 years ago, I'm like, oh my gosh, I've aged older and heavier. But when you look at these big ranges, you can see the big change. But just day to day, it's hard to fully appreciate sometimes how much you're changing. And so relying on somebody who is a supportive secondary feature to have a conversation about driving, I think, is a really important thing to do, because at the end of the day, if you're making decisions about your driving, you're gonna have a more dignified process of maybe retiring from driving, as opposed to sometimes you have people who are just so resistant to even thinking about, maybe I'm starting to be impaired. And then maybe a family member or a physician tries to talk to them, and they don't even want to hear about the driving because they're so petrified about letting it go. But it's cases like that where sometimes the license has to get revoked just for that own person's safety, so, and the safety of others. But because it's a privilege and because it's a responsibility, because it's about safety and life or death, I think it's really important for people to take that personal responsibility, start thinking, start planning, and talking to people. So there's ways that you can go about making decisions about your driving when you start to become impaired. So one thing is, you could retire yourself. You can make the decision for yourself, I'm just not going to drive anymore. Now, other cases is like my dad had something very similar to Parkinson's, and the family was noticing that he wasn't safe with driving anymore. So he thought he was still good, but my mom, me, my husband, my brother, his wife, we saw that he was becoming unsafe. So I sat down and had a one-on-one talk with them, and he didn't want to stop driving, but he thought about it for a couple of days. And then, knowing that he had a supportive, caring family that was looking out for his best interest, he did agree to stop driving after a couple of days. And that was a huge relief for everyone in the family. It was a huge stress reliever. So this is the other thing, is that a lot of people think, well, I don't want to stop driving because that's going to put more responsibility on my spouse and they're going to have to drive us everywhere. Well, yeah, that's true. But in a lot of people's and families' cases, your spouse and your family member sometimes is going to be less stressful for them to do all the driving than to worry about you driving when you're impaired. That is so stressful for people, and stressful to even talk about, like think about talking to a family member about driving, because you don't want to hurt your family member's feelings. You don't want them to get angry at you. You don't want them to think that you don't think that they're capable. But at the end of the day, sometimes you have to have those tough conversations, because that's better than having that person get hurt at the end of the day. So that's another way that people can just assess themselves and have other people help assess them and make decisions about driving without going through a process of a medical driving review. Sometimes a person and their family member or their physician may get concerned. Maybe we need to have a formal driver's evaluation. And that's when a medical referral is made to a person like me. Now, also in our state, since we don't have any laws requiring people to get retested, we do have a medical review process in our state. And as far as I'm aware, all states have a medical review process. So this is another way that either you come by doctor referral, or you come because somebody has officially reported your name to the State Department of Motor Vehicles in your state. So, like, for example, I had multiple people who actually reside in Massachusetts, but they had accidents in Massachusetts. And the police officer who came to the scene of the accident put those folks under medical review in Massachusetts. And that puts an alert on your driving privilege, and actually they suspend your license. And then you have to, go to some kind of process or medical review with a person like me to see if you're still safe to drive. So you can come through the medical driving evaluation process voluntarily through the referral of a physician, or it can be kind of mandated through a state medical review process by the Department of Motor Vehicles. And that is under threat of, if you don't get this done within an appropriate time frame, we're going to automatically revoke your driving privilege. So when you come for a medical driving evaluation, you will be, you'll ask to give your complete medical history, because again, anything in your medical history, even beyond Parkinson's, can affect you in some way. So it's good to have a very full and complete picture of what your medical status is. Also, your driving history is asked about. Of course, that makes sense, because if you're having lots of accidents, that's evidence that you're not being safe. But I'll say, just because you have no accidents doesn't equal you are safe. It could just be that you've been fortunate and you've not had the accident yet. So, but your your driving history is taken. Another point that's important about that, though, also is really only your recent driving history is the most important. I take it all, and it's great if you've had no accidents for 60 years. That's wonderful. But you're not driving today the way you were 30 years ago. So we really have to look at just the past couple of years of your driving too. Any accidents, fender benders, close calls, tickets, citations. Have you been hitting anything that was not moving, like a parked car, mailbox, garage, column, pillar, curb, tree, shrubbery? Do you have difficulty driving at night, fog, rain, ice? Is something you deal with up north that we don't have in Florida, but definitely a risky situation. Have you been driving somewhere that's familiar to you, but become suddenly disoriented as to where you are or where you're going? Any of these things would be red flags in your driving history. And also going back to medical history, your list of medications is also something that comes into play because medications can affect people greatly. Uh, and with your Parkinson's medications, you know, if it's real Parkinson's disease and not Parkinsonism, then you have your dopamine medications, your Cinemet, and things like that. And generally with those medications, there's on times and off times, on times and off times. And so that is part of the conversation when working with people with Parkinson's disease. And that can obviously affect your driving and also whether or not you're sleepy during the day and have daytime drowsiness. Then the other areas of the testing then look at your strengths and your weaknesses as far as physical capabilities go. Your vision, you have to meet legal standards for vision for driving. In my case, I'm not an eye specialist, so I have an eye tester machine, kind of what you would see at the local DMV to check people's vision. And cognitive testing is the other part, is your thinking skills. So what are physical things that with Parkinson's that are of concern for driving? Well, we know that Parkinson's slows people down physically. And we're speaking somewhat in generalities, but we also know it slows people down physically. And so again, you have that combination of that impairs your reaction time behind the wheel. You combine slowed physical ability with slow mental ability, and that just naturally impairs your reaction time. And driving is so fast, and we know it's imperative that people be able to respond and think quickly. We also have on the physical side coordination. We know coordination becomes impaired with people with Parkinson's. You have tremors sometimes that could be quite severe. And also just, you know, coordination is your brain telling your body to do something and then your body being able to do it very precisely and quick and smooth. So like one of these is one of the coordination tests that we do, finger to nose tip. And you want to be precise with your location and also not herky-jerky and not slow in order to be accurate. But that's just one example of one coordination test. But with coordination impairment, that definitely affects driving. It's another part of the reaction time, your ability to observe something quickly, process it quickly and accurately, get your body to respond quickly and accurately. So with people with Parkinson's, sometimes you see them hit the wrong pedal accidentally because of the coordination and or the tremor, or have difficulty grading the smoothness of the acceleration and deceleration with the pedals of the car. So that's just a few examples, but physical impairment is a big part of Parkinson's and its ability to impair one's driving. And then I also mentioned that there's vision changes that you can experience too. And so you might experience some dry eyes, some double vision, difficulty reading, or even just changes in, you know, you have muscles that control your eye movements. So just like your muscles are impaired, controlling your ability to walk and coordinate those mobility, it's the same with your eyes. It can impair your eyes' ability to move.
Brandy, if I could
Yeah.
jump in for just a second, because we're at
Sure.
about the halfway mark, and I want
Sure.
to remind our viewers, if you have any questions for Brandy, because this is a webinar format, we can't see you. We can't see you raise your hand if you have a question. So please go to the bottom of your Zoom screen. There's a Q&A bubble. And if you could just type your question into those bubbles, then we are happy to answer them for you. And then when Brandy's finished with her presentation, then we can answer your questions.
Okay, so just getting back to something else that's problematic with people with Parkinson's and driving is your ability to twist and rotate. Typically, you get a very forward flexed posture, and that posture in and of itself limits your ability to twist and move and rotate, which means it hinders your ability to turn and look out the back windshield when you're driving in reverse, and impairs your ability to look and check your blind spot. And so rotation is another thing to take into account. And also sometimes people get stuck in a certain position and have difficulty coming out of that. And when you have slow reaction time, that means if you are going along behind the wheel and you see something that comes suddenly that is a hazardous situation, it's just, you have less of a ability to get yourself into a safe situation before, there's something bad that happens with an accident. The cognitive testing on the mental side, well, in our state, there's legal requirements for distance vision and peripheral vision, but we also test for things like depth perception, because even though that's not a legal requirement, it's still important for driving. And also to see if there's any double vision going on. So we check stereo fusion and color vision. And then when we go into the cognitive testing part, there's one test that I do that looks at some traffic knowledge, like rules of the road. But the other tests that we do are all medically based tests that look at different skills that correlate to being a safe driver. So things like visual scanning, visual perception. Of course, driving is very visual, so we're going to be trying to look at visual skills that are involved. One's ability to pay attention, and not just pay attention, but pay attention to more than one thing at a time. Because anytime you're behind the wheel, there's many things coming at you at once. So you have to have the ability to divide your attention and attend to multiple things at one time successfully and efficiently to be safe behind the wheel. We also look at things like problem solving, forward planning, and memory. And all of these things are done with tests that are developed and researched and considered valid in the medical community. So that way, when the report goes back to the physician who referred the person, that physician knows what those tests are and what the implications are. And then also, if the person is under official legal medical review by a state Department of Motor Vehicles, like in our state, they have a group of doctors who is their medical review board, who reviews all the medical cases. So in that case too, they also are aware of these medical tests that are done for cognition and what the implications are. And that helps everyone make decisions about whether or not a person should continue to drive or not. So, but you have to, if you don't do well enough on the clinical testing, then the instruction is made to just stop driving based on low abilities. You have to do adequately on that clinical testing to earn the privilege of moving on to a road test where you actually demonstrate your practical skills behind the wheel. Now, in our state, our medical review board requires me to do a very thorough and in-depth road test with a person that even includes driving on the interstate. Now, that may not be the case in all states, but that's what my medical review board requires. So our road test is like any road test. You start out in a mostly vacant parking lot or an area with cones. You do basic parking lot maneuvers. And then if things are appropriate at that time to move forward, then we move out into some neighborhood driving. And then if it's appropriate, we move out into some traffic. We do light, moderate, heavy traffic, single lane roundabouts we have around here, double lane roundabouts. So we do all of those, and also the interstate. So our road test is quite thorough. Depending on traffic, the person is usually driving for about 60 minutes. And the whole time I'm instructing them on where to drive. At the stop sign, go to the right, that sort of thing. So, but it's done incrementally to keep it safe. If there's issues on the front end, we don't do the full route. We'll cut it short if we need to for safety. In our program's case, we do allow people to take more than one road test if we think that's appropriate. But you do have to pass a road test in order to get that medical endorsement that you're safe to get back onto the road. And I'll add that when you do a medical driving evaluation, that doesn't necessarily mean also that I'm safe to drive for the rest of my life. You know, if you're a 60-year-old and you pass your medical driving evaluation and you have Parkinson's, that's great. But 1-2 years down the line, you may need to be reevaluated if things change. So it's not an endorsement for forever. It's just an endorsement for as long as you kind of stay in this current state. But if anything new medical happens, like God forbid you have a new diagnosis like a stroke, well, that entirely changes the situation. If you have a change in a medical situation or decline, you change in your vision, your change in just your cognitive ability, any of those areas would warrant a reevaluation. So sometimes it's appropriate to get evaluated more than one time. Our particular program, because I work for a hospital, and we're very concerned about liability and safety. And also, as I mentioned, I work with the medical review board. I coordinate with the medical review board at the state level. So if a person comes through, and I'll use the example of, say this is a person who is 85 and they have advanced Alzheimer's disease. So sometimes a person will come through and they won't pass the testing. And so I'll instruct them, you have to stop driving. Well, people who have dementia or Alzheimer's of some type, sometimes the disease process prevents them from seeing how impaired they are. So they'll say, well, I think I'm fine to drive. So regardless of what you're saying and what the testing says, I'm going to drive anyway because I know I'm fine. Well, in that particular case, it's not ethically, morally, professionally okay for me to allow the person to drive when I know that they are not safe and they could hurt themselves or someone else. So there are certain cases where in our program, if you don't pass the testing and you're not willing to comply with the results of that testing, there are cases where I'm obligated to report the person myself to our state and ask them to revoke the driving privilege for their own safety and the safety of others. So not all programs are like that, but that is part of our program. And I think it's appropriate because there is liability if you know someone could hurt themselves or kill somebody else. You can't just let that go. So, and since our program coordinates with the state, when they get the recommendation from me and the test results, they will revoke based on that. And then we move into a conversation with the person and their family about alternative means of transportation. And this is something that even in our area, it's getting a lot easier to get around if you transition to being a non-driver because there is Uber, there is Lyft. Our local government actually, you know, even though we do have the county bus system with the big buses, they also implemented little small passenger minivans that you call on demand and they come get you, kind of like a county Uber. It doesn't cover our whole area, but it covers outlying areas. And there's also some senior, some programs in our local area that are nonprofit, and they, if you get on their list, they'll come and they'll pick you up if you need a ride. So because of these other programs being started, it's becoming easier to make the transition to being non-driver, still have good quality of life and good flexibility to go when you want to go. So I was trying to save some time at the end for questions, and I see that it's 1:45, so I think I'll just see if there's any questions.
Yeah. Okay. So we do have a couple. But before we do that, I wanted to I made some notes because I really like how you presented that this is something to be included in your retirement plan. Never would we think like, oh, we have to include what is going to happen to our driving skills as we retire. And I think that's brilliant for you to say that because, you know, just like you're planning financially for how you're going to take care of yourself, this is part of that big plan. So that's a really good thing to think about. And I'm kind of curious to the people who are still listening out there, did you think of that? Do you have a plan already maybe that you're thinking about? A lot of the seniors that I work with, many of them do have a plan. Some of them say, they have a an adult child that lives in town that is going to be taking over their driving for them, and it's easier for them to give up the keys. So that was good. The other thing I wanted to say before we answer these questions is, this is something that happened to somebody that I know with Parkinson's disease. This person moved, and in moving, updated their license address, right? Which required some kind of maybe a new application, I think, or I don't know what happened, but then they had to fill out and disclose that they had a neurological condition, which then ended up with their license being revoked. It took like almost 2 years of a process for that person to go through driving rehab, to get recertified, or excuse me, relicensed as a driver. So maybe if you could just spend like 30 seconds on that, does that happen often?
Was this our state?
Yeah. Mm-hmm.
Yeah, this can happen. So I think it would be more fair to require people to just get retested, everyone get retested at a certain interval. But since we don't have something like that, what we do have is a system where you renew, and sometimes you can renew online or through the mail. And in that case, no one at the local DMV puts eyes on you, right? Nobody at the local Department of Motor Vehicles sees you, and your license gets renewed. Again, a lot of impaired people falling between the cracks with that kind of situation. But occasionally you're required to go in to renew, or if you have to update your address or something like that on your driver's license. And when you go in physically to the office, they are instructed to look out for red flags, things that could be of concern. So if you present with a significant tremor, or if you're having difficulty walking up to the desk, or if they ask you questions and you're not making sense, they're supposed to follow up and ask, is there something, do you have a neurologic condition, this kind of thing? And as soon as you say, well, I have Parkinson's or something like that, I have multiple sclerosis, I had a stroke, they're supposed to stop that process and not allow you to move forward. They're supposed to put you under that official legal medical review. And that puts you in a position of having to provide your medical history and try to prove that you're still safe to drive. And for some people, that can be a relatively short process where you just provide information from your doctor. And sometimes they will let you continue to drive. Sometimes they say no. Sometimes after you've provided information from your doctor, they want more information. And they say, well, now we're going to ask you to have a certified medical driving evaluation done because your medical history is not enough information to make this big decision.
Mm-hmm.
And so sometimes people come see me for that reason. But yeah. So if they ask you, or if it's on a form that you have to fill out and they can find out that there is something that could be a concern, then yes, they can put the kibosh on your driving
Right.
privilege. Yeah.
That's interesting. Which is unfortunate because it makes people almost go into a situation where they may lie, and which is unethical, but they may find themselves where they're trying to just not disclose that they have a neurological condition. And that's
Right. And
unfortunate.
that's why I think it is unfair, because there are diagnoses that I see out of proportion. Like I get a lot more people with Parkinson's because people can recognize of those kinds of physical impairments in people, or even like with multiple sclerosis and stroke. Those things are more, it's easier for a layperson to pick out those physical impairments visually.
Mm.
But then you have the person who has cognitive impairment or dementia, and they could be physically walking beautifully. They look very fit a lot of the times, but mentally they're very impaired. But a lot of times with dementia, they can cover for their mental weaknesses, crack a joke, deflect a question, and they seem normal, even though they really aren't. And so that's why I think in our state in particular, it's really a bad system, because we have a lot of people who are driving, who are just falling between the cracks, and those are the folks with dementia, because that's invisible.
Yeah.
Whereas I do think this process unfairly captures people with something like Parkinson.
Okay, thank you. So I'm going to jump into the questions that people have out here. Okay, number one is there a list or a website in each state for certified medical driving therapists like yourself?
What a great question. There sure is. So there's actually, just like there's a medical association for doctors, there's a driving association for driving evaluators. So, and that is called Association for Driver Rehab Specialists. So it's called ADED for short, ADED. So A is in apple, D as in dog, E as in educate, and D as in dog. So you can search on them just generally, or the website is www.aded.net.
So I'm going to enter that into our chat. So those of you who want to go down to the screen, bottom of your Zoom screen, and in your chat, I've added it in there. And it's, that way you can directly click that link. Actually, I'm not sure if it's a link. You might have to copy and put it in your browser. Okay.
Yeah, so I'll just add that when you go to that website, you have to look up at the top, and there's a menu with different selections. So you just have to find the right one for doing a search on your rehab specialist, your driver rehab specialist. But there are some people that are certified and some people that are not. So in my state of Florida, our state medical review board requires the person to be certified in order for them to accept that driving evaluation. So you could find somebody, but different states don't all require that. So you have to know what your state is asking for. In our state of Florida, last time I checked, we had around 40 driver rehab specialists, but only about 11 or 12 are certified. So, and in some cases, you have to travel a little ways to see one. I mean, I'm the only one about in an hour radius in any direction. But sometimes some people have private companies and they'll come to you if you can't get to them. So you just have to see what's available. But if you go there, it gives what their specialty is, what their contact information is, and you can call and find out.
Okay. All right. Here's another good question. I have Parkinson's myself, the person says, as well as a circle of my friends at various stages. Some of these friends have offered me a ride to various events, but I do not feel safe being on the road with them. Thus far, I have simply declined with some excuse. Are there any suggestions as to how to be more truthful without hurting feelings? Or is it more important for them and others to be safe?
Yeah, that's a tough one. Of course, everyone should be safe, but the problem is some people really believe that they are safe, even though they're not. So, but I think I always err on the side of just having honest conversations as much as possible, because I think that's just the direct, honest approach, I think is the best way to go. But it takes some tact, and, I've been talking to people about driving for a long time, and it's still, people get very angry sometimes and emotional about it. But what I find is that if you take time to actually talk through the situation with people, though, in an empathetic and honest way, most of the time at the end, they're very grateful and appreciative. So, but it takes, and it would help too if there are some facts that you could have to kind of back up what you're saying. Like if you could provide an example, you know, you you hit the pillar when backing out of the parking space, you scrape the car, or you have this certain situation happen and it made me feel a little bit nervous or uncomfortable. And that might help to provide some specific examples. A lot of times people make a lot of excuses for things that they do or don't do. But part of what I try to do is not allow them to do that, because, if you're in a car, for example, and you backed up into something that was not moving, there's nobody responsible in that situation but you. If you're behind the wheel, you're the one in control of that vehicle. The other object wasn't even moving, so you can't even blame it on another driver. That was just 100% you.
It's totally understandable because, driving, and I understand it's a privilege, not a right, but driving is just such a huge part of being independent. And so, when we take that away, or when somebody loses that little bit of independence, it's just another piece of their independence going away. I mean, as if the disease hasn't taken enough, they're going to start losing things around them too. And so I totally understand how people could get angry or upset when this conversation comes up.
Yeah, yeah, it becomes very personal. They take it very personal at first, but I think if you talk with them enough, or if they know you well enough, they might understand that you really have their best interest at heart, as well as, you're trying to look out for your own personal safety, which should be understandable. Um, I would, you said something I was gonna go to. What was it?
I don't know. Let me jump to the next question. You can think on that. So I have a question here that says, what is done in driving rehab? So what are you actually doing in the rehab? I know you went over it, but maybe just break it down a little bit.
Yeah, so it starts out as evaluation. It's just evaluation to see, are you safe and capable of continuing to drive? At least in our program, that's how it is. And then there becomes, in some cases, rehabilitation may be appropriate. In many cases, it's not. So again, that 85-year-old with dementia, that's not a rehabilitation case. This person, again, to be honest and frank, that person's medical diagnosis and their age and other things affecting them, the expectation is that person will continue to have more difficulty and more decline, not a reversal. So it depends on the case. And with Parkinson's, honestly, it ends up falling into that same category like dementia. We know it's a neurodegenerative process. So many times with people with Parkinson's and Parkinsonism, it ends up not being something that's rehabilitative. But there's always, there could be a singular case that might be an exception to the rule, but in general, it's more like driving retirement. If someone came to me and they were, just say, potentially a younger person, they had early onset Parkinson's, and they fell and broke their hip, and so had surgery and had to go to rehab, and so they haven't driven for 6 months, say, and now somebody's referring them for a driving evaluation to see if they can get back to driving. I could see that person might be able to get back to driving if they're of a younger age, they were active before. The Parkinson's is early, it's very mild, the signs and symptoms are very mild, then that person could certainly potentially be able to return to driving. And if it's no at first, for some reason, we might evaluate, well, what is that no for? Sometimes people are just hesitant to get back to driving because they haven't done it for 6 months. So if I give them a little bit more time behind the wheel, they get more comfortable and confident again, and then they're ready to get back on the road. So there could also be a situation where maybe, say somebody also has neuropathy in their legs. And so because of their sensation is so impaired in their feet, they can't feel the pedals well. So maybe this person has a mild case of Parkinson's and now they can't drive with their feet because of the neuropathy. Sometimes I can transfer a person and teach them how to drive with adaptive equipment with hand controls. So now you're driving with your hands instead of your feet. That's another rehabilitative approach because you're learning new equipment that you have to be trained on. Or if you had mild Parkinson's and you had a stroke, well, the stroke impairs you temporarily, but with time, people can improve greatly and sometimes get back all of the things that they lost with the stroke. And so in that case, it could be rehabilitation. But you hear me saying repeatedly in those cases, that's probably a person with mild Parkinson's. Because
Right.
once you get more into moderate to severe, the slowness and the cognition and the reaction time is really prevents people from still being safe. And another aspect, and this is actually what I was going to say a few minutes ago, it came to me. This was the other thing is that, so again, I shared that my dad had something like Parkinson's. And so this is my personal experience with him, but also professionally with others. And like I said, these changes can happen so slow that you don't see how much it's affecting you. So, and I mentioned that he was also becoming an obstacle to everyone on the road because he was driving too slow. It was taking him forever to park and people were honking at him. Okay, people honking at you, that's another sign that you may be losing your skills. But when he did give up driving and my mom became the primary driver, one day he was complaining to me, your mom, she drives really fast. She drives like Mario Andretti. I'm like, oh, really? This is very interesting, Dad. So, and I'm like, well, I might have to have a talk with her. So, but then I asked him, I said, well, so when mom's driving, is she driving over the speed limit? And he said, no, she wasn't driving over the speed limit. And that was just a really enlightening case for me because that showed me, and it showed him too, his disease process, again, which was like Parkinson's, slowing him mentally, slowing him physically. So he had become so acclimated to this new slowness that was happening to him that somebody driving a normal speed is now uncomfortable. And it feels like Mario Andretti to him. It's all this stimulation coming at him so fast, like it's Mario Andretti, but it really isn't. It's just regular speed limit.
Well, that's a really good point. Good point. And I've
So
heard
the
that from people.
perspective, yeah, the perspective you have changes because you just feel more comfortable doing things at a slower pace because it's harder to process and react. So, yeah.
Well, we do have a few more questions. So here's someone saying, do you think reaching out to their family and them, if you know them well enough, to share your thoughts and concerns to see if they are aware of what you're seeing? I'm assuming that question might be going back to like, how do you have that discussion with somebody? Maybe that's what that is.
Yeah, I'm a huge advocate for that because, that's what I did with my dad. And I just think that this kind of process is available to people and it's great if this is what you need, but not everybody necessarily needs this. Right now, our program, it's not a cheap thing to go through. most programs in our state are $500 or $600 for your standard medical driving evaluation. We charge by the hour, and it's $150 an hour.
Is any of that
But
covered by insurance?
it's generally not.
Oh, so it's a self-pay evaluation.
Right. And that's, and so in our case, it can take anywhere from 2 hours to 8. If so, for me, the way we do it is we split up the clinical testing and the road tests, and everything is 2 hours on average. So if a 2 hour clinical could be $300 with our program, a 2 hour road test appointment. So that's an hour, that's a few minutes to prep in the beginning, an hour of driving, and then some constructive criticism time to discuss how everything went at the end. That's another 2 hour appointment. So that's $600 there for those two. And if people want to retest again, it's again another appointment with another charge. And then the rehabilitation is the same. The more rehabilitation sessions you do, it's more money. Now, some people, though, this is really what they need. And this is the best place for them to get that service. And
But
so
also it's the
sometimes
first,
you just have to bite the bullet, but other times you can avoid this process and have conversations with family and therapists and physicians and get their feedback too.
but also isn't it the first step in proving that you are a safe driver if your license has been suspended or revoked due to Parkinson?
Yeah, if you're under an
Necessary.
official medical review process with a state Department of Motor Vehicles, yeah, first they're gonna ask you for medical history from your doctor. But if that's not enough, the second part is a certified medical driving evaluation. Yeah, and so in
Yeah,
that case, you don't have the choice.
yeah,
It's essentially mandated under threat of revocation.
right.
Yeah.
Here's another question. I have a friend who gave up driving with Parkinson's, but then had DBS, deep brain stimulation surgery, and resumed driving. What are your thoughts?
That is a possible, that is possible. So that would be, a very specific case. And that's a big procedure to undergo, the deep brain stimulator, and people have differing results from that. So, but I have seen it it is possible, yeah, that they could undergo that and then get back to driving if they had a very significant improvement. But I think also in that case, you still have to, I would still want that person to be demonstrating that they have good insight, good judgment, good self-awareness, good self-discipline and self-control, where they can look at themselves and say, because you fluctuate, even with the deep brain stimulator, you can
Sure.
fluctuate. So I would like to see them, understand that when I'm in a good way, physically and mentally, then I'm good to get behind the wheel.
Right.
And when I'm having a bad day, I need to stay home
Right.
or
Good
get a
point.
ride. Yeah.
Well, we're actually over time, but we have two more questions, so hang in there. All right.
Okay.
One is, do you have to disclose to the DMV when you're diagnosed with Parkinson's? We kind of touched on that, like ethically, morally, if you're asked to fill out the questionnaire and the application again, you may have to disclose that, but do you have to legally, like, what if you didn't and then an accident happened and they found out you didn't disclose that? I don't know. Do you know anything about that?
I don't know the answer to that. I and I have differing opinions on it too, because I think it's one thing if you go into the local Department of Motor Vehicles and somebody asks you verbally what's your medical history is. You're not writing anything down. I don't know if you have to legally disclose that or not. To me, your medical history is private. We have laws protecting your medical history, like HIPAA. And so I would think that you would have some freedom to choose what you feel is appropriate to disclose about your own personal, private medical history. Now, on the flip side, though, if it's a form that they're asking you to fill out and it's official government form, and you're trying to get a government issued driver's license through that process, there may be some legal ramifications if you're dishonest on that, I would think. But this is a good question, and I think I need to follow up and try and get some more answers, because I should know the answer.
It's okay. It's okay. I get asked that all the time. People ask me all the
Yeah,
time, should I just lie and say I don't have Parkinson's? And really, it
yeah.
just becomes an ethical and a moral question at that point, I believe.
Yeah, and I've worked with a lot of people too who just, I find a lot of people are just honest, and they'll just say. But unfortunately, sometimes that does mean that they get captured in a process that
Mhm.
maybe wasn't really appropriate for them at that time.
Yeah, I know. And I think that has happened before to people. The
Yeah.
final question, and then we should go because I know we're over our hour. Um, there's a couple that I recently was talking to, and the husband had Parkinson's, the wife did not. So he gave up driving so that she could drive, which was fine. They was all decided upon. But then he decided he wanted to keep his driver's license, not turn it into a state ID, but as a driver. And it was interesting because I didn't realize that when you do that, your actual car insurance is still going to be at the same rate as if you had two drivers. Maybe that doesn't really apply to today's lecture, but do you know anything about that? Like, is it best if you're going to give up driving that you also turn in your license and get a state ID?
That's a good question too. So, well, all insurance questions, I would refer people to their individual insurance companies. Um, in my personal opinion and professional opinion, it's better to just turn the license in. Um, and I say that for multiple reasons. One, it's just good faith. You're not going to drive. You've made that decision. So it just follows. This is the appropriate action to take next. Secondarily, I find that sometimes people will be in an emergent situation, like their spouse is having a medical problem. And so sometimes they will say, oh, well, because it's an emergency, I'll drive. Because I still have my license in my pocket, and I'll drive my wife to the hospital because she needs to get there. Well, that's not a good choice. Obviously, if your spouse is having a severe medical emergency, you want to call 911, number one, because they'll be able to take care of that issue faster and more appropriately and more safely. But so sometimes if the people keep the license in the pocket, they think that they'll backtrack on their decision given what the circumstances are. The other thing is that sometimes if a person has some kind of cognitive impairment, and you can get cognitive impairment or even dementia sometimes in Parkinson's, sometimes people even forget that they're not supposed to drive, and they have that license in their pocket, and so they pursue that. So those are issues I try to avoid, and just let it be a clean slate, start fresh. Now, the other thing is that the driver's licenses and the state IDs both have expiration dates on them. They both have to be renewed. So this is another thing. If that driver's license just sits in the pocket, eventually it's going to expire. And so if you then go to use that for something important like voting or traveling or writing a check or getting a specialty medication, if they actually check it and it's no longer valid, you may not be able to do what you're trying to do. And I do find that people don't look at that date, and they have expired license in their pocket,
That's a really
and they
good point.
didn't they didn't even know it. So that's another thing. You can just go ahead and switch to the new ID card, and it starts you on a whole new cycle. I think in our state it might be 8 years. So,
Mhm.
but I have to say that there are some times where people are just really desirous of keeping that driver's license. And so I can't always convince people to turn it in. But it's easier for me to allow that kind of thing to happen though, as long as there's somebody else in the picture who is available and supportive and present, and making sure that even though the person has the valid license, that they're not actually driving.
Mhm. Well, thank you. Thank you, Brandy. I would like to take this opportunity to thank Brandy Pouso and also Sarasota Memorial Healthcare System for your time today on this webinar. We have learned so much really great information about when to give up your driver's license and if it's necessary when you have Parkinson's disease. So again, thank you, Brandy, and we look forward to seeing you again. Everybody
Thank
out
you.
there, bye-bye.
Thank you.